Well, thanks to things like treatment advances and greater awareness, more men are surviving their prostate cancer diagnosis.
But it doesn't end there, because so many men undergoing prostate cancer treatment still have to fight for their quality of life and their dignity.
The man you're about to meet is a soldier, but he's also a survivor.
Hello, my name is Michael Best. I'm 71 years old.
Hello, my name is Jackie Best, and I'm 72 years old.
I joined the Army back in April of 1974. At the end of 1974, I did my first tour of duty in Germany, and I stayed in Germany for the first 3 years. Came back to the States, and I was stationed at Fort Stewart, Georgia. Oh my goodness. I met Jackie back in 1990 here in Augusta, Georgia, as I was going through military training school. And I was actually at a party, and it was my birthday. I used to love to dance. That's why I would go to places, you know, the clubs and things like that. Well, I said, maybe I just go back to the barracks. So I got up to leave, and in the back of the room, I'll let my wife tell you the rest of the story.
Well, I love to dance, so I asked him to dance, and that's where it started from.
We were married in March, on my birthday, 22nd of 1997.
I'm his birthday gift forever.
That's right. And I thank God.
And he won't forget it either.
That's right. She won't let me.
We have 14 grandchildren and 9 great-grandchildren.
Oh, yeah. Oh, okay.
13. I can do all things with Christ.
I was in Liberty University going through for my pastoral counseling degree for master's. And then that's about the same time that I met Dr. Klaassen.
My name is Zach Klaassen. I'm a urologic oncologist at the Georgia Cancer Center in Augusta, Georgia. You know, I think with urology, there's such a personal relationship with patients, and I really got to feel as a medical student that this is the kind of patients that you're going to see in the clinic. You're going to maybe take them to the operating room, but you're going to follow them probably for their entire life. And really, the cancer patients are the ones that I really connect well with. Hey guys, how are you? It's good to see you. How are you?
Good to see you.
We're going to go over your prostate cancer results in the clinic, okay?
Okay.
All right, go on this way.
You know, I never really felt afraid, but it's based on, I know what it's based on, is my faith in God.
I can do all things through Christ who
That's right.
strengthens me.
And that's where I felt,
Yeah.
you know.
The biopsy did show some prostate cancer. So I know that's not what anybody wants to hear.
Oh, definitely not.
No, and we're going to talk about options for treatment.
You know, as a urologist, prostate cancer is the most common cancer that we treat, and it encompasses a huge portion of our practice, whether it's localized all the way to advanced prostate cancer. Localized prostate cancer is the most prevalent or the most common in the United States and across the world. What localized prostate cancer is, the disease is confined to the prostate. It hasn't spread to the lymph nodes or the bones or other organs. We've had a tremendous amount of advancements in metastatic prostate cancer in terms of extending not just longevity, but quality of life. When it comes to localized prostate cancer, we have sort of our classic ones that we've had for a long time, surgery or radiation. So if we can catch this early and we can treat them, this is the goal, is to extend life later on. You know, the goal is to try to avoid advanced prostate cancer.
I had an uncle that died from prostate cancer. It's because he never followed up on anything. Because once the cancer gets outside of the prostate, you know, and you can limit it.
So we know that our 2 most common treatments for localized prostate cancer are surgery, removal of the prostate, or radiation, using radiation beams to treat the prostate cancer in the prostate. And we know with localized treatment options, we're shooting for a cure for these patients, but there's often side effects associated with any treatment that we're going to do.
Taking the prostate out, I didn't like the side effects of that. Radiation does damage to your body, and so you have to what's best for you.
With radiation, those same nerves that affect both incontinence and sexual function are right there in the radiation field as well. And so we know that over time, men may have some sexual dysfunction that deteriorates. They also may have some overactive bladder during and after the radiotherapy as well. And so the third one with the radiation that we don't see quite as much with surgery, but more with radiation, is rectal toxicity. When we think about the space between the rectum and the prostate, these organs are very close to each other, about a centimeter. This is a very personal area that we're dealing with, right? And so when the radiation beams from treatment are hitting the prostate, they're also hitting the rectum as well. And that's where we think the rectal toxicity comes from. And rectal toxicity can take many forms. It could be constipation above baseline. It could be diarrhea above baseline. It could be rectal bleeding. We've had a solution for rectal toxicity for a while now, and this is the rectal spacers to create space between the prostate and the rectum to basically allow the radiation therapist to be aggressive with their planning and spare the rectum from the radiation therapy. I've been doing rectal spacing since about 2020, and so in 2022 I learned about Barrigel, and it quickly became my favorite rectal spacer. Barrigel rectal spacer is intended to temporarily position the anterior rectal wall away from the prostate during radiotherapy for prostate cancer, and in creating this space, it is the intent of Barrigel rectal spacer to reduce the radiation dose delivered to the anterior rectum. With the Barrigel rectal spacer, we have the opportunity to try to prevent the rectal toxicity that we know happens with radiotherapy. When we're talking about Barrigel, I really like to discuss this with my patients because this is truly a quality of life procedure.
We decided to do radiation with Barrigel. For Dr. Klaassen, I felt very comfortable because he gave off the aura of someone that was concerned, not just a doctor, and when I feel that way, there's a sense of calm, of peace. So we decided, after many discussions, the pillow talk, late night talks, and early morning talks, and things of that nature, we weighed our options. And I said, well, based on our research as well, we said, yeah, that would be the better way to go.
When we do the procedure, it generally takes about 10 to 15 minutes, and this may vary based on everybody's setup in the clinic or the ASC or the operating room. The Barrigel rectal spacer is going to be inside you until your radiotherapy is done, and then over time the body will resorb it. This is hyaluronic acid, natural product in the body, and so when it's done its job and you've done your radiation, it will naturally reabsorb itself.
It was interesting how the Barrigel is absorbed in your body. That's a nice feature. Plus, it also protects your rectum from radiation.
After doing the radiation with Barrigel, I had no rectal side effects.
Barrigel is the only rectal spacer that I use in my practice, and this is based on my experience, the data that we have, the patient safety, the comfort level that I have doing the procedure, and just the results that we've seen not only in the clinical trial but also in the real world as well. When we look at the prostate cancer survivorship journey, we're going to try to cure this, but there's also a quality of life assessment because we expect you to live another 30, 40 years as a prostate cancer survivor. We see them in follow-up for PSA surveillance. We ask them the questions. It's really rewarding to be able to have that feedback that they're doing great. They're not having the diarrhea and the constipation that we worry about that can happen without a rectal spacer.
We found that the radiation and Barrigel, working hand in hand, could help someone. And that's why we're here, to help someone.
It makes you think about that, how far cancer has come, because now it's not a death sentence, but you have to listen to your body. When something is wrong, you have to go to the doctor. He's been a minister now about 5 years, and I've seen him grow so much.
My faith has become much stronger. I've become more mature in my faith because of the prostate cancer. What's more important, living or these things that we, walk around saying, well, if I don't have that, I just don't have any life. I'm just glad to be alive. And this is what we have to say.
That's it.
That's it.
What a very special couple. And we'd like to thank Minister Michael Best and Jackie Best, and of course, Dr. Zachary Klaassen.
And for more information about the Barrigel rectal spacer, go to barrigel.com.
And of course, you can also learn more at thebalancingact.com. Now stay tuned for some important safety information.